Welcome to the deep dive. Today, we're zeroing in on a really crucial part of our bodies, the hip joint.
Hmm.
You might not think about it much, maybe knees or shoulders get more press. But the hip is, well, it's arguably one of the most important joints we have.
Absolutely. It's fundamental.
Yeah, but
Right.
it's not just that it's big, right? It's the incredible functionality it allows for, like almost all possible movements, huge range of motion.
Every direction.
Exactly. Walking, running, just getting around.
Yeah.
It all starts there. So you can imagine if something goes wrong with it,
Oh, the impact is huge.
right, you're going to feel it big time. Okay, let's unpack this. Today we're taking a deep dive into hip osteoarthritis, a condition that really affects how you move, how you live.
Precisely. And we're going to look at, what exactly is hip osteoarthritis? How does it actually start? And what are the causes? Because they're not always what you think. We'll cover symptoms too, how you might identify it.
Even the tricky ones.
Yeah. Especially the tricky ones, like pain showing up elsewhere. And really importantly, we'll get into some of the more natural treatments available, things you can try to, well, hopefully avoid surgery or at least push it off as long as possible.
Okay, that's the key.
What's fascinating here, I think, is just how central this joint is to everything we do daily. And there's so much more to it than just, my hip hurts.
Definitely. So let's start with the basics, the healthy hip. What are we looking at anatomically?
Okay.
It's basically the connection point, right? Where your leg bone, the femur, joins your pelvis.
That's it. The top of the femur, your thigh bone, has this rounded head, almost like a perfect ball, a hemisphere. And this ball fits into a corresponding socket in the acetabular cavity, that sort of cup shape.
A ball and socket. Nice fit.
Ideally, yes. A very precise fit. And both that ball and the socket lining are covered with cartilage.
Right, the cushioning.
Exactly. It's actually pretty thin cartilage, but it's incredibly strong, very resistant. And then you have synovial fluid inside the joint.
The lubricant.
Yeah, think of it like oil. It keeps those two cartilage surfaces super smooth, well lubricated, so they glide past each other with almost no friction. That's what allows for that amazing movement you mentioned.
A perfectly engineered system, really. Smooth gliding. Okay, here's where it gets really interesting. What happens when this perfect system starts to, well, break down?
That's the core of osteoarthritis. The issue usually kicks in when that smooth cartilage surface starts getting damaged. Imagine tiny imperfections developing, like little potholes or rough spots, almost like microporosities.
So it's not smooth anymore.
Exactly. And once it's not smooth, the friction between those surfaces increases dramatically every time you move.
Ouch. I can almost feel that grinding.
Right. And that constant increased friction, that grinding action, is what ultimately generates or leads to hip osteoarthritis. It's fundamentally a breakdown of that smooth, frictionless movement the hip relies on.
Okay, so if this breakdown is happening, maybe slowly at first,
Yeah.
how would you know? What does hip osteoarthritis actually feel like? I guess most people just assume, pain right at the hip.
That's the logical place, and sometimes it is right there. But very, very often, the main pain you feel is actually in the groin, the inguinal region.
In the groin, not the side of the hip.
Not always, no. Often the groin. And here's the really surprising part, the clue that often cracks the case. The hip often weeps through the knee.
It weeps through the knee. Wow, that's quite a phrase. What does that mean in practice?
It means the pain doesn't stay put. It can radiate almost like a waterfall down the front of your thigh.
The front.
Yes, the anterior part. And it can travel all the way down to the knee, sometimes feeling like it's in the knee itself.
Okay.
Honestly, I've lost count of how many times we've diagnosed hip osteoarthritis in someone who initially came in complaining only about knee pain.
So they think it's a knee problem.
They're convinced it's their knee. It's a really crucial diagnostic hint, but one that can be easily missed if you're not looking for it.
Wow. That really is eye-opening. I bet a lot of people listening might be thinking about aches they've had. So how do you differentiate? If the pain is in the knee, how do you trace it back to the hip? And beyond just the pain, what other signs are there? Limitations?
Great question. It requires a really thorough exam. We do specific tests, moving the hip in certain ways, to see if that reproduces the pain, even if the patient points to their knee. We don't just focus on the knee itself. And yes, absolutely, beyond pain, limitation is a huge factor.
Like what kind of things?
Everyday stuff. You start noticing difficulty with things you never thought twice about. Getting in or out of the car becomes a struggle. Stepping into a bathtub, maybe lifting your leg over the side. Even simple things like putting on socks and shoes.
Oh yeah, bending down.
Bending down, rotating the hip, or trying to cut your toenails, these things become increasingly difficult. The joint feels like it's getting tighter, more restricted.
More retracted, less mobility.
Exactly. It's progressive. You just lose that range of motion over time, and it really starts to impact your daily life, makes things a real chore.
I can imagine. Just tying shoes can feel tough sometimes. Okay, so we're getting these signals, the pain, the stiffness. Now let's talk about the why. We hear osteoarthritis and instantly think, okay, that's for older people, right? Like maybe 80s, 90s.
That's the common association, and yes, age-related wear and tear is definitely a major factor for many.
But not always.
Not always. There are other causes, and one really critical one can cause what we call premature osteoarthritis. It can hit people much younger.
Younger? How young?
We sometimes see it in patients in their 30s, maybe 30, 35 years old.
30. Wow. What causes that?
A condition called novia, that stands for necrosis osseous vascular or vascular osteonecrosis, AON.
Okay. Necrosis means death of tissue, right?
Exactly. In this case, it's the bone tissue in the hip, specifically the head of the femur. What happens is the blood supply to that part of the bone gets cut off or severely reduced.
No blood flow.
And if tissue doesn't get blood, it can't get oxygen and nutrients, so it dies. This bone death leads to the collapse of the bone structure and very rapid, severe osteoarthritis.
That sounds serious.
It is. That's why diagnosing novae quickly is so important. You have to take action fast because, well, hip osteoarthritis setting in when you're only 30, that often carries a poor prognosis if you don't intervene early.
That's really sobering. Something you associate with much later in life hitting so early because of blood supply. Okay, so besides novae, what else is on the list of causes?
Well, there's a whole range. Lifestyle factors definitely play a part. Things like smoking.
Smoking. How does that affect the hip?
It affects circulation, blood vessel health systemically, which can impact joint health. Alcoholism is another factor, and prolonged use of corticosteroids. Steroid medications often used for inflammation or autoimmune conditions.
Right, and weight.
Oh, absolutely. Overweight and obesity are major contributors. It's simple mechanics, really. The more weight you're carrying, the more load you put on that hip joint with every step.
More stress, more wear.
Exactly. We also see it frequently in athletes.
Because of overuse.
Intense, repetitive stress, excessive use of the joint. Think high-impact sports over many years. And then there are the biomechanical factors.
How your body moves.
Precisely. Think about the forces coming up from your feet and legs when you walk or run. They all travel through the hip. So if you have issues lower down, like, say, flat feet or very high arches,
Wow.
or even if you have osteoarthritis in your knee that can change the way those forces hit the hip, it alters the force vectors, the internal biomechanics of the joint.
So a problem in your foot could eventually cause a problem in your hip.
It absolutely can. It throws off the delicate balance inside the joint, changing how the cartilage gets loaded, potentially accelerating wear and tear. It really shows how interconnected everything is, doesn't it?
It really does. Foot bone connected to the hip bone, quite literally. Okay, so it's a complex web of causes. Now, let's say someone has hip osteoarthritis. They're feeling the pain, the limitations. What can be done? I know a lot of people hear osteoarthritis and immediately jump to thinking about surgery, hip replacement.
And look, sometimes if the joint is really badly deformed, if the damage is too extensive, surgery is the necessary path. There's no getting around it.
Right.
But what if you catch it earlier? What if you're still a tempo, as they say, still in time? Are there other options? Especially natural ones, regenerative approaches, to try and avoid or at least significantly delay needing that surgery.
That's the million-dollar question, isn't it? What are these regenerative treatments?
So regenerative medicine in this context is all about stimulating your body's own healing and repair mechanisms. Instead of just managing symptoms or replacing the joint, the goal is to actively encourage the damaged tissue, the cartilage, to regenerate.
Kind of heal it from the inside out.
Exactly, empowering the body to fix itself.
Okay, let's unpack this innovative approach to healing. One term we hear a lot, especially in sports injuries, is PRP, platelet-rich plasma. How does that apply here?
PRP is a fantastic example of using your body's own resources. See, within your blood, you have these tiny components called platelets.
Right, they help with clotting?
They do, but they also play a crucial role in tissue repair. They're packed with growth factors, proteins that signal your body to heal and rebuild damaged tissue.
Okay.
So the PRP procedure starts simple. We draw a small amount of your blood, just like a regular blood test.
Hmm.
Then that blood goes into a special machine, a centrifuge. It spins the blood very fast.
Separating the components.
Precisely. It separates and concentrates those platelets, creating a solution that's much richer in platelets and therefore growth factors than normal blood.
Platelet-rich plasma, got it.
Then we often activate these concentrated platelets. There are different ways, sometimes chemically or using light, called photoactivation. This essentially breaks them open slightly to release those potent growth factors.
Unleashing the healing power.
You got it. And then this concentrated, activated PRP solution is injected very carefully directly into the hip joint.
Right into the damaged area.
Yes. The aim is to flood the joint with these natural repair signals, encouraging that damaged cartilage lining to start healing itself.
That's fascinating. Using your own blood to kickstart repair.
Yeah.
Now, what about stem cells? That sounds even more fundamental. Is that like bringing in the construction crew, not just the repair signals?
That's a really good analogy, actually. Yes. Stem cell therapy takes it a step further by introducing cells that can actually become new tissue.
Where do these stem cells come from?
We have them naturally inside our bones, particularly in the bone marrow. These are mesenchymal stem cells, and they have this incredible ability. They're pluripotent, meaning they can differentiate or transform into various types of specialized cells, including cartilage cells.
Wow.
So the procedure involves carefully extracting a small amount of bone marrow, usually from the hip bone itself or another. So it sounds intense, but it's done very carefully. That marrow sample is then processed in the lab to isolate and concentrate the stem cells. And often, for maximum effect, these stem cells are combined with PRP or sometimes even medical ozone gas.
A cocktail of healing agents.
Exactly, creating synergy. Then, this regenerative cocktail is administered. Usually part of it is injected directly into the hip joint, just like the PRP.
Right at the source.
And sometimes another part is given intravenously, systemically. The idea here is a two-pronged attack: local repair and systemic support for regeneration. We're aiming not just to repair damage, but to actively regenerate new, healthy cartilage tissue.
That really does sound like a paradigm shift. Moving from just managing the decline to actively trying to rebuild the joint. Okay, so let's say these treatments work. PRP, stem cells. The joint starts feeling better, maybe regenerating, less pain. What happens next? Is that it?
Not quite. That's a fantastic step, but getting the joint structure healthier is only part of the picture. We also need to address how the joint functions. That's where combined manual therapies come in.
Hands-on treatment.
Yes, specialized physical therapy. Once the joint itself is better, less inflamed, maybe starting to regenerate, and you have less pain, then it's the ideal time to start working with hands-on techniques.
Why is that necessary?
Because after dealing with osteoarthritis, even if the cartilage is improving, you've likely developed stiffness, muscle imbalances, and poor movement patterns around the hip. The joint capsule might be tight, muscles shortened or weakened.
Compensating for the pain.
Exactly. So manual therapy focuses on restoring the joint's proper biomechanics. This involves gentle mobilization techniques to improve the joint's range of motion, stretching tight muscles, strengthening weak ones, working on the tendons, ligaments, even the joint capsule itself.
Getting everything moving correctly again.
Precisely. We need to address all the soft tissues around the joint and retrain the movement patterns. The goal is not just short-term relief, but long-term function, to ensure the problem doesn't just come back to prevent a relapse.
Makes total sense. Heal the joint structure, then restore its proper function. It's a complete approach.
If we connect this to the bigger picture, these treatments represent a profound shift towards empowering the body's natural healing and regenerative capabilities, followed by restoring optimal function.
This has been an incredible deep dive. We've really unpacked the hip joint, its vital role, those surprising symptoms like pain showing up in the knee, the diverse causes, going way beyond just age to things like avascular osteonecrosis in younger people, lifestyle factors, biomechanics, and then these really innovative treatments, PRP, stem cells, followed by crucial manual therapy. It's a powerful knowledge to have.
Absolutely. And hopefully it helps people understand their bodies better, which, leads to a final thought.
Go for it.
This raises an important question, doesn't it? Considering how interconnected our body is, how the hip can weep through the knee, what other subtle signals might your body be sending right now? Signals that are maybe going unheard, perhaps even from a part of your body that seems completely unrelated.
That is a great question to ponder, encouraging all of us to listen a bit more closely, maybe question where aches and pains really come from, and just be more proactive and curious about our health. Thank you for joining us on this exploration of the hip joint and hip osteoarthritis. We hope you feel better informed and maybe a little more amazed by the body you live in. We'll catch you on the next deep dive.